Before watching this video, don't forget to click on the subscribe button. Flurbiprofen is a non-steroidal anti-inflammatory drug together with analgesic and antipyretic activity. The FDA has approved use of flurbiprofen in October 1988. It shows some similarity to ibuprofen, naproxen, and others medicine. Uses or indications. Flurbiprofen is effective in the treatment of pain, fever, and inflammation in the body. Flurbiprofen is indicated for the treatment of rheumatoid arthritis, including juvenile arthritis or Still's disease, osteoarthritis, ankylosing spondylitis, musculoskeletal disorder, and trauma such as periarthritis, frozen shoulder, soft tissue injuries such as bursitis, tendinitis, tenosynovitis, low back pain, sprains and strains. It is also indicated for the treatment of mild to moderate pain in conditions such as dental pain, post-operative pain, dysmenorrhea, migraine, and menstrual cramps. Mode of action. The flurbiprofen works by blocking the production of enzymes that are responsible for stimulating the pain, such as prostaglandins or cyclooxygenase, that results in the low concentration of inflammation, pain, and fever. Dosage and administration. For adults, recommended dose is 150 to 200 mg daily in 2, 3 or 4 divided. In patients with severe symptoms or disease of recent origin or during acute exacerbation, the total daily dosage may be increased to 300 mg in divided doses. For dysmenorrhea, a dosage of 100 mg may be administered at the start of symptoms, followed by 50 or 100 mg every 4 to 6 hours. The total daily dosage should not exceed 300 mg. Geriatric population. Although flurbiprofen is generally well tolerated in elderly, some patients, especially those with impaired renal function, may eliminate non-steroidal anti-inflammatory drugs more slowly than normal. In these cases, flurbiprofen should be used with caution and dosage should be assessed individually. Pediatric. Flurbiprofen tablets are not recommended for use in children under 12 years of age. Contraindications. Froben is contraindicated in patients with known hypersensitivity to the active substance or to any of the inactive ingredients. Flurbiprofen should not be given to the patients who have experienced asthma, urticaria, or allergic type reactions after taking aspirin or other non-steroidal anti-inflammatory drugs. Flurbiprofen is also contraindicated in patients with a history of gastrointestinal bleeding or perforation related to previous non-steroidal anti-inflammatory drug therapy. Flurbiprofen should not be used in patients with acute or history of ulcerative colitis, Crohn's disease, recurrent peptic ulceration, or gastrointestinal hemorrhage, defined as two or more distinct episodes of proven ulceration or bleeding. Flurbiprofen is contraindicated in severe heart failure, renal failure, or hepatic failure. Flurbiprofen is contraindicated in last trimester of pregnancy. Precautions. Caution is necessary if flurbiprofen is given to patients with a history of heart failure or hypertension, since edema and fluid retention have been reported in association with flurbiprofen administration. Flurbiprofen, like other non-steroidal anti-inflammatory drugs, may inhibit the platelet aggregation and prolong the bleeding time. Caution should be used when initiating treatment with non-steroidal anti-inflammatory drugs such as flurbiprofen in patients with considerable dehydration. Caution is required in patients with renal, cardiac, or hepatic impairment, since the use of NSAIDs or non-steroidal anti-inflammatory drug may result in the deterioration of renal function. The dose should be kept as low as possible, and renal function should be monitored in these patients. On prolonged use of any painkillers, headache may occur that must not be treated with increased doses of the medicinal product. Through concomitant consumption of alcohol, active substance-related undesirable effects, particularly those that concern the gastrointestinal tract or the central nervous system, may be increased on use of non-steroidal anti-inflammatory drugs. Gastrointestinal bleeding, ulceration, and perforation. Flurbiprofen should be given with care to the patients with a history of peptic ulceration and other gastrointestinal disease. Flurbiprofen should only be given with care to patients with a history of peptic ulceration and other gastrointestinal disease, because these conditions may be exacerbated and there are more chances of gastrointestinal bleeding and perforation that may be fatal in elderly patients. Respiratory disorders. So the bronchospasm has been reported with flurbiprofen use in patients with a history of bronchial asthma, cardiac, renal, and hepatic impairment. The caution is required in patients with renal, cardiac, or hepatic impairment, since the use of non-steroidal anti-inflammatory drugs may result in the deterioration of renal function. Cardiovascular and cerebrovascular effect. The appropriate monitoring and advice are required for the patients with a history of hypertension and or mild to moderate congestive heart failure. as fluid retention and edema have been reported in association with flurbiprofen administration in other non-steroidal anti-inflammatory drug therapy. Dermatological effects. The serious skin reactions, some of them fatal, including exfoliative dermatitis, Stevens-Johnson syndrome, and toxic epidermal necrosis, have been reported very rarely in association with the use of NSAIDs. Renal effects. Caution should be used when initiating the treatment with NSAIDs such as flurbiprofen in patients with considerable dehydration. Hematological effects. Flurbiprofen, like other NSAIDs, may inhibit the platelet aggregation and prolong bleeding time. SLE and mixed connective tissue disease. There may be an increased risk of aseptic meningitis, especially in patients with existing autoimmune disorders such as systemic lupus erythematosus and mixed connective tissue disease with symptoms of stiff neck, headache, nausea, vomiting, fever, or disorientation. What about the excipients? Flurbiprofen tablets contains lactose, so the patients with rare hereditary problem of lactose intolerance. Lactase deficiency or glucose-galactose malabsorption should not be take this medicine. Drug interactions. Care should be taken in patients treated with any of the following drugs as interactions have been reported in some patients. Number 1. Diuretics, ACE inhibitors, and angiotensin II antagonists. So the non-steroidal anti-inflammatory drugs may reduce the effect of diuretics and other antihypertensive drugs. Diuretics can also increase the risk of nephrotoxicity of NSAIDs in some patients with compromised renal function, for example, dehydrated patients or elderly patients with compromised renal function. The co-administration of an ACE inhibitor or angiotensin II antagonist and agents that inhibit the cyclooxygenase may result in further deterioration of renal function, including possible acute renal failure, which is usually reversible. These interactions should be considered in patients taking flurbiprofen concomitantly with ACE inhibitors or angiotensin II antagonists. Therefore, the combination should be administered with caution, especially in the elderly. Patients should be adequately hydrated and consideration should be given to monitoring of renal function after initiation of concomitant therapy and periodically thereafter. And now lithium salts that decrease the elimination. And third one is anticoagulants such as warfarin that enhance the effect of anticoagulants. As with other products containing NSAIDs, concomitant administration of Froben and aspirin is not generally recommended because of the potential of increased adverse effects. Cyclosporin, cardiac glycosides, corticosteroids, COX-2 inhibitors, and others. NSAIDs may decrease the elimination of methotrexate. Moreover, it can also interact with quinolone antibiotics, mifepristone, tacrolimus, zidovudine, and many others. Well, this is not a complete list of drug interactions. You may ask your doctor for the complete list of interactions of flurbiprofen. It is also important to know that flurbiprofen has an ability to impair the female fertility, as the use of flurbiprofen may impair the female fertility, and it is not recommended in women attempting to conceive. In women who have difficulties conceiving or who are undergoing investigation of infertility, withdrawal of flurbiprofen should be considered. Labor and delivery. The onset of labor may be delayed and the duration increased with a greater bleeding tendency in both mother and child. Well, now about the lactation. So the flurbiprofen has an ability to excrete the human milk, and it is not recommended for the use in nursing mothers. Flurbiprofen adverse reactions. Gastrointestinal disorders. The most common adverse reactions are nausea, vomiting, diarrhea, flatulence, constipation, dyspepsia, abdominal pain, melena, hematemesis, ulcerative stomatitis, gastrointestinal hemorrhage, and exacerbation of colitis and Crohn's disease have been reported. Less frequency of the gastritis, peptic ulceration, ulcer perforation, and ulcer hemorrhage have been observed, while the local irritation with the suppositories occur. The pancreatitis has been reported very rarely. Now, immune system disorders. So the most common adverse reactions of the immune system disorders are hypersensitivity reactions that have been reported, and the allergic reaction, anaphylaxis, respiratory tract reactivity comprising asthma, aggravated asthma, bronchospasm, or dyspnea, assorted skin disorders including rashes of various types, pruritus, urticaria, purpura, angioedema, and very rarely erythema multiforme, bullous dermatosis, including Estevans-Johnson syndrome and toxic epidermolysis. Infections and infestations. The exacerbation of skin infection-related inflammations, for example, development of necrotizing fasciitis coinciding with the use of NSAIDs, has been described. Cardiovascular and cerebrovascular. The use of NSAID, particularly at high doses in long-term treatment, may be associated with an increased risk of arterial thrombotic events, for example, myocardial infarction or stroke. The nervous system disorders are including headache, dizziness, general disorders and administration site conditions are fatigue, malaise, and edema, while the investigations, the common in the liver function tests are abnormal, bleeding time may be prolonged, and the metabolism and nutritional disorders is common as result in the fluid retention.